Hello everyone, welcome to my channel. Myself Dr. Megha from Yogic Homeo Science. Today I'm going to talk few medicine which are really helpful in curing the cough. Whereas first you should know what is cough. Cough is a sudden forceful hacking sound to release air and clear an irritation in the throat or the airway. Whereas cough is of two types. One is acute cough and another one is chronic cough. Chronic cough are very difficult to cure, and acute cough it's really easy and it will be gone within 1 or 2 days. So there is no need of trying much more about it. Different types of coughs are allergies, asthma, common cold, flu, and any other viral infections, lung infections, and others. You can also differentiate like this. When you get fever, of course, you get an cough with a fever because of the throat infection or something else. So you should know some homeopathic medicines if you are an really an genuine person who is looking for an homeopathic medicines for all type of diseases which you suffer for. In my clinic I keep means as an acute remedy for the cough is first one is Bryonia alba, because I'm so much into Bryonia alba because it is an drug which gives me literally good results in all kinds of patient, because it covers the dry cough, worst on moments with pain in the head and the chest, cough at the night making the patient sit up to avoid suffocation, cough with the headache. Next one is about acute cough only, antimonium tartaricum. Whereas in this you can see the hoarseness, whereas in the bryonia you cannot see the hoarseness, where there will be great rattling of mucus but very little comes out, and the patient will be saying that the mucus is there but it's not coming out, doctor. So it is one of the symptom for the antimonium tartaricum. Next, moving on to the antimonium car, where it is a cough of old people with asthmatic breathing, where it comes in the chronic cough, and you can also prescribe in a acute cough, but it mostly covers the chronic cough. So I think of it during the chronic cough. Whereas next one is arsenic alb. Arsenic alb is given when there is a cough in the midnight and lying on the back, and the patient always should complain. If you're thinking of arsenic alb, means the burning should be accompanying the person. Then wheezing respiration is there during the chronic cough, you can think of arsenic alb, and during the acute cough also during fever when there is burning sensation you can think of arsenic alb. There is no issue in that. Whereas next one is epasulf. Epasulf covers the chronic cough, because whenever there is an lung infection or throat infection you can think of epasulf, because it is one of the chronic medicines. And there is dry horse cough and worse during the dry cold winds, during the uh, November and December time you can think of arsenic alb, sorry, epasulf. Next one is capsicum. Capsicum is given when there is a dry hacking cough, exploding an offensive breath, and there will be explosive cough, means like an cough, like that type of cough. That time you can think of. Next one is causticum. Causticum is given in the old age people, dry cough in the evening from tickling in the trachea or the throat you can think of. Involuntary urination while coughing you can think of in the old age people. And cough in the soreness, cough with the soreness, sorry. Then the patient will be always saying that there is a mucus which is stuck in my throat and it's not at all coming out. That time you can think of. Whereas next one is one of my favorite, that is Drosera. It is always given during the acute attacks. Of course it's also cures in the chronic attacks, but I'd always given it in the acute attacks when there is an when the patient gets wet in the rain and they get fever with a cough, that time the dosera is really fantastic. That time you can think of dosera. Next one is dull camera, winter cough, a must strain to explore the mucus, must cough a long time to expose the means to make the mucus come out, and cough after the physical movements or some kinds of thing, means if they are getting up from the bed there will be an cough. During that time you can think of dull camera, but dull camera is only given during the winter season, like that type of thing. Next one is Kalium Kali bike, whereas Kali bike is given in the chronic diseases. I give it in the acute and chronic diseases, but I give it in the asthmatic patients or the chronic bronchitis patient, acute bronchitis patient, any patient who is suffering with the means any old age patient or any patient who is suffering with the asthmatic attacks, you can think of this remedy. Next one is kalikab. Kalikab is given, means it has one of the specific symptom. I differentiate kali bike and kali carb into two things. One is I always give kali bike. If it is not curing, I go for the kali carb when they say that there is an difficulty in breathing and the cough is between the 2 to 3 a.m. in the midnight. During that time I think of calicap. Next one is pulsatilla. Pulsatilla is given in the acute symptoms. Of course it is one of the favorite and fantastic during the dry cough and hard cough with a great weakness in the chest, dry cough in the evening and at the night, and the patient always must have to sit up for and relief. That time you can think of pulsatilla. Where pulsatilla I give it mostly for the cough, but some people think that it is only for the woman, but no, you can give for any person, male or the female. There is no need of differentiating when it comes to the acute diseases, not in the chronic diseases. Next one is restrox. Restrox I give it cough with the fever or cough with the body aches, and it is one of the acute, and in the old age also I give it. Whereas next one is Rumex. Rumex is most probably prescribed by so much of physician, homeopathic physician, because it is also one of the very good and peculiar medicine for the cough, and the patient always feels better. But the Rumex is given during the dry cough and not during when the patient will be saying there is a mucus. Don't think of Rumex. Next one is tuberculum. Tuberculum is a dry cough during sleep, expectoration thick, profuse and easy, and there will be always an suffocation type of thing, and the patient cannot take the fresh air and they always feel like there is something wrong with their throat. Next one is spongia, gray dryness in the hair passages, dry cough sounding like means very hard, like the hoarseness there will be there due to the cough, and tickling in the throat is also kind of seen. And these are my go-to for the cough kind of treatment during homeopathic treatment. By this I'll be ending this video, and if you really like my videos, please do like and subscribe, and don't forget to press on the bell icon, because whenever I put a new video about the new diseases and new treatment, you will be able to see that video first if the bell icon is being pressed. So please do like and subscribe, and don't forget to press on the bell icon. Thank you. Have a nice day. Bye bye.